The first exercise that is going to be an upper body push exercise is going to be an overhead shoulder press. So things required is we're most likely going to use a chair. If the woman is in her first trimester, then she can go ahead and stand up and perform this exercise, but as the pregnancy goes on and things become a little bit more unstable, probably a chair is the best bet to do this exercise and the safest way to do this exercise. Another thing we'll need is dumbbells, anywhere from 5 to 10 pounds. And the way we're going to do this exercise is we're just going to hold these dumbbells at a 90-degree angle like this, and we're going to press up and back down. Now, a common mistake that could be made with this is, I'm going to turn to the side, is that there could be excessive arching of the back. This is due to not using and engaging that core. By engaging the core, then we are performing that exercise in a straight line. This is especially important for pregnant women, as a lot of the time they experience low back pain due to the excessive weight in the front of their abdomen. So by being able to engage that core, not only helps the exercise, but just encourages proper form just functioning throughout the day. The next exercise is going to be a bicep curl. So once again, if the woman is in her first trimester, still feeling pretty good, it's fine to do it standing up, but as the pregnancy progresses, once again sitting in a stable chair. We're going to use dumbbells again. Once again, around 5 to 10 pounds, whatever feels comfortable. We don't want the woman stressing while she's doing this, but also still providing a challenge. The bicep curl is going to be a pull exercise, so we're going to just lift in a controlled way like this. Nice and slowly with those elbows close to the center. We don't want the elbows all the way out here. We want them nice and close to the midline. Another thing to make sure of is that the woman is not holding her breath at all during this. Encouraging normal breathing while performing any of these exercises is important because we don't want to create any excess abdominal pressure inside. That's just going to be healthy for the mother and the baby. A good lower body exercise during pregnancy is just a simple squat. So we're going to use this chair as a stabilizer because one of the most important things during pregnancy is that we don't want to have the woman do any exercises that are going to increase her risk of falling or injury or anything like that. So just with a regular squat, we're going to have this chair, making sure that it's a nice stable chair. It's not going to tip over. We're going to have her hold on to the chair just for support, feet shoulder distance apart, and just doing a squat down using that chair for support. A couple things on this is making sure that the chest isn't super far forward. Once again, there's a lot of weight in the front section of her abdomen. So making sure that we're engaging that core, sitting back so that we're not leaning over. Strong core muscles, once again, are going to be very important during a pregnancy. We're just going to go down and up. We don't want to go excessive knee bending, only to 90 degrees. Because once again, we don't want to put the joints at risk. During pregnancy, a lot of the time the joints loosen up and put the woman at a higher rate of risk of injury. So 90 degrees, performing the squat, using the chair as support.